We were looking at kind of health and wellbeing support for patients who are on active treatment and also as well patients who had advanced disease. And I was working in a role where we support patients over the phone to express their concerns, and also as well looked at cancer survivors. And I used to be, when I was a chemo nurse, I used to sort of like want to throw them a happy, congratulations, you finished your chemotherapy, but didn't realise like some of the effects that long-term side effects that cancer treatment can actually have. So I think it's really important because a lot of the concerns that were expressed were like fears of reoccurrence, and also as well more like PTSD, so like post-traumatic stress disorder, and I think they needed a lot of support after their treatment. What I actually did is I was assisted by, I took a proposal to the Florence Nightingale Foundation and said that I wanted to expand the kind of work that we do and look into sort of the research behind it as well. And by doing this, I wanted to sort of network with other people because it's quite a new thing in oncology. Is survivorships. It's probably mainly in the past 10 years. What I decided that I wanted to do is I looked at cancer survivorship programs around the UK and also as well over in the US. So put a proposal together to go out there and go to a few centres in the UK as well, which got accepted. So it was a networking exercise basically, just between myself and some of the providers of the other survivorship programs. And the main outcomes that came from that was just that we all have the same challenges as well, which was like, we all have problems with computers, etc. We all have problems that we need more time for administration. And just the fact that it is difficult to sort of set up a new program. So we've thought about things like good, effective leadership. And also as well, we looked at what the key themes were for cancer survivors. So a lot of the centres had like support for sexual health, they had support for counselling, like complementary therapies, things like that. And also as well, a lot of rehabilitation support. And the main outcome was that we could kind of easily fit within the area that I was working in. We could have introduced the Macmillan recovery package and helped to deliver that to our patients, which was really exciting. I think one of the things that came from the research is that, and also as well I saw in my patients when I was talking over the phone, was that they do like lose a lot of confidence. You're on treatment, you get subjected to, you get some horrendous news that you've got this cancer diagnosis, and then also as well, it's your worst fear. And then you're having treatment and you end up with disfigurements. Not everybody obviously on cancer treatment, but some. And it isn't for everybody. But if you're feeling not good after treatment, please talk to someone and tell someone and fight for the fact that you need extra support. There is a lot of support that's coming out there as well. Macmillan are doing a lot of help, and there is a lot of support out there, but you do have to go looking for it. So one of the things that came from the literature is that patients after treatment tend to lose a lot of confidence, and that's why there's a lot of support there to try and help people to access services. But do try and shout out.